Hi, everyone. I'm Katie Couric here in our New York studio talking with my friend and colleague, Dr. Jon LaPook. We occasionally sit down and talk about sort of some pressing medical issues of the day. And recently there was a pretty disturbing story about a woman who went to the emergency room in Kings County, New York. She was a psychiatric patient, John. She wasn't tended to in a prompt fashion, and she ended up dying.
Right.
Her family obviously is irate. It's a tragedy. And we're here to talk about how you keep that from happening to you or someone you love. First of all, what's the situation in emergency rooms across the country?
It's really a problem. We're overloaded. There are fewer emergency room beds. They're being shut down, actually, and the number of people going to the emergency room is going up.
That's because the number of people who can afford health insurance is going down, right? So a lot of people use the ER as their primary care,
There are
right?
47 million people who are uninsured, and those people are coming to the emergency room often as to find their primary care, for colds, for things that really they should be seeing their primary doctor for. And in addition, as a country, we don't do preventative care very well. So even people who have insurance, they still come into the emergency room with their asthma uncontrolled. And
right.
There's no
I was going to say
that.
the underinsured or another segment of the population that's using ER. So, all right, so what can the average consumer do? Let's say you're in a situation where you have to go to the ER. What kind of things can you recommend in terms of getting the proper care and not being ignored like that poor woman was?
Well, for one thing, go with a buddy system. Do not go to the emergency room alone. Now, sometimes you just get taken to the emergency room and there's no way that you can predict that. A cell phone, I know not everybody can afford a cell phone, but they can be really life-saving in those situations. So if you're on your way to the emergency room, call your buddy, have them meet you there. That buddy's going to work the system from the outside.
Or take you, by the way, because oftentimes you won't be in the kind of shape you can drive yourself, right?
That is true. And you also want to, so you're alerting the system, having your buddy work the system from the outside. You also want to call your doctor, if you have a doctor, and have them work the system from the inside, so outside and inside.
What about you being transported by ambulance? I mean, I hate, I'm not trying to rig the system or anything like that, John, but I understand that if you come to the ER in an ambulance, you get much faster treatment than if you come in a car, even if a friend is driving you. Is that true?
I don't know if that's true or not, but I mean, the key person there is the triage nurse, right? So when you come into the emergency room, there's a triage nurse, and that nurse is key to what's going to happen to you in the next hour, 5 minutes, 20 hours.
Yeah.
That nurse decides, are you sick or are you not sick?
Right.
That is the key decision.
But sometimes, how can they tell? In other words, how do they determine who gets immediate help?
Right.
Because sometimes someone might look fine,
right,
but be in severe physical distress.
And that's a key sort of trick to keep in mind in terms of preventing a disaster. Because when you come in, if you have chest pain, if you're short of breath, if you are bleeding, if you're a disaster, that's actually relatively easy, because the triage nurse looks at you and says, no problem, emergency. Once you're declared an emergency, pretty much you're going to get the kind of care you should have, or at least you're not going to be overlooked. The problem is, you come in, you're a 35, 40-year-old man or a woman, and you have a little bit of heartburn, and you get labeled heartburn. Okay, non-emergent, this is just somebody who has a little agita, had too many meatballs. And you get put in the non-emergent part of the emergency room. Now an hour goes by, 2 hours go by. You have that label, non-emergent person. And now you develop a little shortness of breath, and maybe you're getting a little chest pressure, and you realize this is a heart attack. Well, you don't realize, but you say your symptoms are changing. At that moment, and here's a tip for everybody, at that moment, tell somebody, okay? Don't just sit there. Tell the nurse, tell the doctor, my symptoms are changing. You know, I told the triage nurse this, but now I'm feeling that. And that really, a lot of the disasters that I have seen in the emergency room are people who were labeled one thing,
and they don't speak up afterwards,
they don't
right?
speak up. So,
so kind of make a ruckus if you have to, so you can get the right care too, right?
And absolutely. And then the other thing, there is one very, very straightforward thing you can do. Just everybody out there, right this second after you finish watching this, figure out who your healthcare buddy is. Everybody on the planet, pretty much, if they don't have a computer, they know somebody who has a computer, or they know somebody who knows somebody who has a computer. Okay? Establish who that person is. Have them type into a word processor or an email what your medical problems are. So angina, high blood pressure, diabetes. What your medications are. The name of it and the dose, not the little white pill, 50 milligrams, how often you take it. The name of your doctors and what their phone numbers are. And then that person has that. Now, let's say you end up going to the emergency room and you may not have that piece of paper with you in your wallet. You call your friend or you call them from the emergency room, but if you have a cell phone, and then they email or fax that document to the emergency room. That happened with my father 1 week ago today. He was in Bennington, Vermont. He developed chest pain in the middle of the night. He ended up going to the local emergency room. He always has that piece of paper, but he didn't have that piece of paper. So he ends up in the emergency room. I am his healthcare buddy. I emailed his medical record to my wife, Kate, who had it on her BlackBerry, who, as she rolled into the emergency room, found the email address of the resident there, emailed it to him. He was printing it out as my father was being taken into the room to be examined.
Well, that's a very good medical buddy to have when your son's a doctor, right?
Well, he's
Will
a great
you be my
guy.
medical buddy?
Absolutely. I'm your buddy any day
But,
of
you
the
know,
week.
that's a good point, because I was thinking, I don't have that in my purse, you know, the names of my internists or whatever, and if I'm on any medication. Well, the list's too long for that. Just kidding. But we should definitely advise people to carry that
such a
around,
simple
or to
thing.
have a friend do it.
And in the best of all worlds, you know, it's a computerized medical system, and you roll in and everybody knows your record, but that ain't going to happen.
All right.
Not
Well,
anytime
thanks
soon.
for the advice, Dr. LaPook.
Happy to be here, Dr. Couric.
You're welcome. All right. And that's it for us.